wife Pam and I have 3 wonderful sons that we've been blessed with, but parenting can be challenging for moms and dads. So where do you turn when everything you do and everything you've tried just doesn't seem to work? Here to tell us about a new free community resource designed to address a wide scope of parenting issues is Paige Marcantel. Great to have you. Now, you are a licensed clinical social worker.
That's correct.
All right, tell us a little bit about what this program is about.
This program is about helping parents before they start to see signs of big issues, larger issues that come along in childhood. So we're really a prevention model so that parents can come see us and learn new things, great information about the brain, how children develop, and how they can best meet their children's needs, starting from the beginning of child development, even when a mom is pregnant and expecting a new child, all the way up until they're teenagers.
Well, everyone is, when they're a parent, they are at one time a first-time parent. And I remember, it was a scary time, and you don't know what to expect. By the time you get to the 3rd child, you ignore stuff. You don't pay any attention then. But anyway, lots of parents that are new, they're concerned, they don't know what to do. And so they need a resource that they can access to help them understand development of children, because they don't really know what is right or what is a problem.
I think that's right, and I think so many parents want to do such a great job. They want to be the best parents, and I say the people that are coming to see us are already great parents because they're out there seeking knowledge and information about their children. They want to know how to do things well and what the latest research really shows on how to help children develop the best that they can, and that's what we're there to support them in.
Now, I know this is at the Women's Hospital.
It is.
So all these new babies that are being born there, it's a great facility. I just had a grandchild there, just a great facility. How do the parents access this?
We are very accessible to parents. People can just come right up the elevator to the 5th floor and see us. They can call us. They can check us out on our website, our Facebook page. There are a lot of ways to get in touch with us where they can find out more information. But really, if parents are in the hospital, they just had a baby and they want to come see what we're all about, all they need to do is ride up to the 5th floor. We're right there when you get off the elevator, and they can ask questions, look around the center, and kind of see what things we offer that might be of benefit to them and their family.
What's a couple of the most common questions that come up that you counsel parents with?
A lot of things that people are coming to see us for are things like emotional and behavioral issues with children. So that might be a child that's really struggling with behavior, maybe in a school setting or in a child care setting, and how can a parent best handle or deal with that? We've also had parents come to see us because maybe they're divorcing and the parents want to know best how to effectively co-parent that child. We've had parents come to see us who are parenting children that have special needs or developmental delays, and there's a different type of stress that comes along with that. So we're really there to help parents with a very wide variety of issues and things. It can be common childhood challenges like how to potty train, if you don't feel like that's working well for you at home, but all the way to really larger issues like mental health needs of children and teenagers as well.
So you have some practical advice as well as clinical advice.
Yes.
Because I know I could have used that help on potty training with my 3.
Yes.
But if someone accesses you, is there an age that their child, any age criteria? I mean, will you talk about an 18-month-old as well as an 18-year-old?
Yes, really from the very beginning, from pregnancy all the way through the teenage years. So really in anything in between that. And we've had parents come to see us with brand new babies who are colicky, and parents are tired and frustrated and not sure what to do, how to best handle that, all the way up to I have this teenager and he doesn't seem real motivated, and what can I do to help him? How can I help him find something that he's going to feel successful at? So it really is a lot of different things.
You know, unfortunately, the child abuse that we see today sometimes stems out of lack of education and information about how to handle situations because they just don't know what to do.
That's right, and I do think that we tend to parent the way that we were parented. So if a person really struggles with parenting and they look back and think, well, gosh, my parents struggled being patient with me, or my parents didn't know how to handle this, sometimes we pass those things along. And it's great for people to say, well, I didn't really feel like these things worked for me as a child. What can I do differently? How can I learn and set a different standard or a different pattern for my own family? And we're here to help support that process.
Well, this is very exciting. An issue that usually comes up when kids start school is children that may have learning disabilities, and parents don't really know what to do about that. Is that something that you could help with as well?
We have someone in our office who really focuses on that, on making sure that parents can get the right help that they need. If there's another program, if there's a doctor, if there's some resources out there that might really help that parent know how to deal with that issue in a better way, we can help them get connected with those things so that they can feel better prepared emotionally to handle the stress of dealing with that child, but also have some practical things in place to make life easier for that child as time goes along.
Now tell us again now how to access you, how to contact you.
People can access us through our phone number, and that's 901-227-9558. They can also look us up on the web or at shelbycountyyupp.com. Or they can come see us. Take that elevator at the Women's Hospital up to 5 and come check us out.
I think it would be worth you doing it. Thank you so much for being with us today. Great information, really new information for me, for sure. Coming up on Health Matters, 3 healthcare organizations are joining forces to bring a new mental health facility to our community. Find out the details next on Health Matters.